Now, many of us want to fight aging, or at least the signs of it. Dr. Joseph Mealy, a board-certified plastic surgeon from Walnut Creek, is here. He's a local doctor who can help you do just that. Now, tell us, Dr. Mealy, what is now the most popular cosmetic surgery going on?
Right now, the most popular cosmetic surgery is breast augmentation. It was liposuction for many years, but in the last couple of years, breast augmentation has taken over.
And with breast augmentation, I'm sure many people have heard about the debate between silicone and saline, and you've brought some examples here. Tell us a little bit about the difference and show us a little bit.
Well, now there is a choice. For a long time, just the saline was available unless there were other circumstances. But with currently we have the silicone gel-filled implant and a saline-filled implant, and the difference is really what's inside. The shell, the part on the outside that actually touches the body, is pretty much the same between the two.
Can you show us a little bit between the two, the differences?
I mean, this is a silicone gel-filled implant. This is a rather high profile implant. They also come as lower profile, so this looks a little bit flatter. The other difference between these two is this is a textured implant, this is a smooth implant. The texturing I use primarily for shaped implants, so implants that are bigger at the bottom, we want that to stay at the bottom and not rotate to the side. The texturing allows the scar to attach like a light Velcro, so it keeps it from moving around. With the saline implants, very similar. They come as smooth and textured. Again, if they're shaped, we tend to use a textured. If they're round, I tend to use a smooth, because the texturing, since it does attach to the scar, if the implant wrinkles a little bit, it may be more visible through the skin.
Right.
So the smooth has that advantage.
And you were talking to us a little bit about, now this textured one that you have here, it looks rougher, but it doesn't feel rough.
It feels soft.
Yeah, it actually, both of these feel soft.
Soft and fuzzy.
You said there's a new breast implant that's coming along that has a very fun name.
There's an implant that's popularly termed a gummy bear implant. It's similar in shape to this. This is would be a saline-filled implant in that it's bigger at one end than the other. And the advantage of that is to give a little more projection at the bottom. With most augmentations, there's a little more projection at the bottom anyway, and we're trying to sort of keep to a teardrop shape. So most of the time a round implant, because we're standing up, tends to give a nice teardrop shape. But for folks who've had breast cancer with mastectomies, the implants we have now are filled with liquid. So if the skin is tight, which it often is after removing the breast tissue and the nipple, it tends to give a rounder breast shape. And if we had an implant that's firm, that has a memory to it, and can stay bigger at the bottom, it can enhance the cosmetic result after reconstruction.
Right. Now let's take a look at the breast. We have a before and after breast picture that we can take a look at here. Sure. Describe here what it looks like an appropriate size. What do you look for when you are trying to get a breast augmentation?
Well, it's a lot of conversation. I ask people where they've been, if they've had children, how large their breast got, if they're bigger or smaller, and it gives me an idea what their comfort level is, where they want to be. I prefer to do augmentations that are proportionate, that match the body. The most important thing is that the width of the implant matches the width of the chest, so that, you know, when we're wearing clothing and such, it works. As we get bigger, it's harder to find clothes that fit, and if we're too small, it's hard to find clothes that fit.
Right, so a little more natural. Back to the gummy bear breast, and it's, you know, the key point is they actually mold. They sort of are like the Tempur-Pedic mattress, right? They sort of bounce back.
Yeah, they're some people will call them memory implants, because if you squeeze them and let go, they'll go back to that shape. So they have shape memory or form memory. They're what's called form stable.
And we should be looking for those when?
When the FDA approves them.
Okay,
which,
FDA
could be soon,
approval.
It could be a while.
Waiting for that.
We've been waiting for a few years now.
All right.